And now on the line is Luke McDermott. Luke is a SIPTU Organiser with SIPTU. Luke, welcome to Near FM.
Thank you, Darren. Thank you for having me.
Luke, yourselves and SIPTU organised a protest at Connolly Hospital in Blanchardstown yesterday, the 9th, about the HSE's pay and number strategy. Luke, for the benefit of any of our listeners listening today who don't know what the HSE's pay and number strategy is, can you fill them in on what it is?
Okay, I certainly can, Darren. So the pay and number strategy effectively was introduced, born from the previous 18 months in relation to the recruitment embargo within the HSE. And during that time, obviously, staffing levels were reduced as people left and the pause in recruitment. So the pay number strategy was introduced from the numbers that were involved in the health service from 2023 and taken forward into 2024. So effectively what it meant was unfilled posts that in 2023 were effectively lost going forward to 2024. Okay? And that was borne out then in frustration on our members who would see colleagues moving on or retiring and without seeing them being replaced. And we're talking about staffing within catering departments, portering departments, radiography departments, nursing, healthcare assistant, and across the board. And the impact on them is very, very much borne out in terms of frustration. And going forward now, what SIPTU are looking to do with their union colleagues in terms of the INMO and Fórsa is that they wish to sit down with the HSE to discuss this pay number strategy and a way forward, because the current recruitment policy that the HSE have implemented is realistically still a recruitment embargo. It really is. The difficulty in recruitment is still there, as if the embargo was still in place.
Okay. I don't believe the PNA were involved in yesterday's demo at Connolly Hospital. Are they involved in the campaign at all, or are they happy with their area, or what's the story, do you know?
Well, again, what I would say is it's across the board within the health service.
Okay.
As well, mental health has suffered as well in terms of the recruitment embargo. There are a number of vacancies within mental health. SIPTU represents nursing in mental health and the HCA grades, and that as well is impacted substantially as well. So,
okay, I heard Phil Hay from the INMO. She told the Oireachtas Health Committee last week that the health recruitment cap is or will be the biggest own goal ever scored. Do you agree with that, Luke?
So, our own colleagues in SIPTU were in the Oireachtas last week also, and also explained the impact of this recruitment policy that the HSE have implemented. And SIPTU have stated their positions categorically that it shouldn't be a case where now that in effect there is still a recruitment embargo in place in the pay number strategy, because that's effectively what it is. SIPTU are categoric on that. They've been in the Oireachtas and stated their position on it as well. And again, these protests are in conjunction with our sister unions in the health service.
Okay, the demo you had at Connolly Hospital yesterday, was that like a local demo or a national demo? What's the story?
So what's at the recording here now is that the planned protests are across October, okay, the whole month of October, at HSE sites. And realistically, when you're kind of having protests, you need to select certain sites, okay, in terms of where this recruitment embargo is having an impact as well. And what we're seeing is, especially in Connolly Hospital, is that our posts unfilled, our members are bearing the consequences of that, okay. We need appropriate staffing levels to deliver the world-class service that our members deliver across the board. And again, with that means identifying where there's vacancies that they are filled appropriately.
And is this issue, the pay and number strategy, is it affecting Connolly Hospital more than other hospitals, or is it affecting all the public hospitals?
In effect, it's all the HSE sites. It would impact the same in terms of the way they have to go through recruitment. Okay. Across the board, you will see, Darren, is that whatever grade you're in, the difficulty is that people are seeing, our members are seeing colleagues that they've worked alongside either leave for a different employment or retire, and without seeing them replaced. And the difficulty then is, how do you continue doing the level of work that you were doing when you had to support the numbers there and that you no longer have? And that's being borne out on the ground with our members. And we're obviously bringing that to the fore here in relation to the pay number strategy. We're making the HSE aware the members' frustration, their employees' frustration with it, and the impact. And again, this comes down to delivering a world-class service for the public, that they have access to services. And what we're saying is, how do you do that when you have a recruitment embargo in place, effectively within this pay number strategy?
Am I right in assuming, Luke, that a lot, or at least some of the people that you're protesting, the workers that you're protesting Connolly yesterday, would have travelled from other hospitals to be there?
So again, what we would have done was, primarily what we have is our members who work in Connolly Hospital would have been the individuals coming out on site to protest.
Okay. I read on the SIPTU website yesterday, Luke, that you're escalating your campaign. Can you tell me what this is likely to entail over the next few weeks? Bearing in mind as well, I'm conscious that there's going to be a general election in the not too distant future.
Again, that would be for SIPTU again to internally review, okay, in conjunction with the members as well, and to see how this escalates in terms of the impact it has with the HSE, whether they notice that there's time to sit down and engage, because that's what it's really about, and it's about sitting down and engaging. The HSE implemented the pay number strategy without any engagement. And as I said, the unions now are feeling it from their members and saying, no, we need to sit down and we need to discuss. And that's the aim here, for the HSE to sit down and have the conversation in relation to how this recruitment policy, how it actually have one that works, and that works for the members, and again, to deliver the world-class service that our members have been delivering all along. But the difficulty is maintaining that world-class service when you're not replacing staff appropriately.
Am I right in saying that the HSC say there is no embargo, but you're saying there's a de facto embargo? So
okay, yeah, sorry, Darren.
No,
in relation to the the pay and number strategy, okay, the instrument here now is that the recruitment policy is not the same as it was before, okay? If an individual leaves a particular department, it could be a healthcare assistant, a catering assistant, a porter, a radiographer, a nurse, a waste management, wherever they're working, it doesn't automatically mean now through this policy that they're going to be replaced. That should not be the case. Okay, it should be automatic that management can recruit into that post that's being vacated. That does not mean it's going to happen, Darren. Okay. That's the crux of everything as well. Is that when an individual in that grade leaves, it doesn't automatically mean that they're going to be replaced.